thank you for that. I want to speak with you about some of the effects from COVID-19 now. And I mean, this has just been a time that none of us were prepared for.
Right.
There's been so many adjustments that we've all had to make.
Mm-hmm.
And it just seems to me, from what I've been reading, what I'm seeing in the media, and just talking to community members, that African Americans have been affected really in the worst way from COVID-19 on all levels, not only just from getting sick, but even, folks losing their jobs, and just all of these different effects with even the housing and, going down mental health issues. And so what have you seen in terms of the effects of this with African Americans in Alameda County specifically? What can you share about that?
Yeah, so, there was already a huge disparity of health in the African American community, even before COVID. And so when COVID hits, of course, the communities that already had, minimal access to care, was not getting all of the care that they should have been receiving for well child visits and well adult visits, right? Not going to the doctor as they should. That, medical racism, cannot leave out medical racism, not being treated like with the same types of medication, the same types of, care given to them. That when a pandemic hits, that of course that community is going to be hit harder.
I've never heard that, medical racism.
Oh, yes.
I mean, I the concept, but just to hear you say that, wow.
So, there have been tons of studies of African Americans going into the hospital and receiving different care, not being heard, not feeling, particularly around maternal care and Black women, not feeling like their pain when they're in labor and childbirth is the same or needs to be addressed in the same way as pain from a white woman. And going to the emergency room saying, hey, I'm having difficulty breathing. Not having that taken as seriously as if you are a white person coming in saying, hey, I have difficulty breathing. So the way we have really accessed medical care is different and is not the same at the high level that we need it to be for everyone.
Okay.
And so starting there, then you get a pandemic that comes and ravages through a community.
Yes.
Who now has the highest rates of cardiovascular disease, right? We have the highest rates of heart disease. We have the highest rates of incidence of cancer. We have the highest rates of, high rates of obesity, diabetes, all of these in our communities, that when we get a disease that targets people who have
all this going on
above, right, makes you a high risk, then of course it's going to impact our community even more.
Yes.
And so that's what we saw with COVID. We saw it come and hit and really hit our community really hard. And then on top of our community being sick, then you still have to battle the medical racism. So you're sick, you still have to go to the hospital, and when you get to the hospital, they dismiss how sick you really are and send you home. And then you go home and die. And so we are just seeing that play out time and time again. We saw that play out in every level of economics within our community. We had doctors dying in the hospital from COVID because they weren't being listened to. And so at every level in our community, it doesn't matter what your educational level is, that medical racism reared its head and impacted us during this time of COVID. So we're battling the disease itself, and then we're still battling the racism that occurs when you go to seek care and treatment for this disease.
So that is all this working against us.
All of this. Yeah.
Yes.
Yeah. And so then your family members say, well, I'm feeling bad, but what's the use of going to the hospital because they're just going to send me away.
Back home. Right.
And so then you don't seek care until it's too late. So then you're on the ventilator, and then we had so many we don't really know the numbers because no one was really taking note of it in the beginning. No one was really looking at who was really dying, whether they were black, whether they were white. The reports were just people were dying. But then finally, doctors started saying, I'm seeing more black people dying, right? Black doctors were saying, it's us that's dying.
Yes.
And then that's when people started paying attention to it and keeping statistics and data. But early on, we really don't know how many people we really lost. I'm sure, in a few years, once we're kind of really through the pandemic, people will go back
and be able to
look at it.
Yeah.
But really right now, we don't have great numbers. But we do know from right now that blacks are 2 times highest number in terms of hospitalization and twice as likely to die from COVID than white people. So we know that right now. But what was it before? It might have been higher, might have been the same. But we know that right now, twice as many cases, twice as many hospitalizations, twice as many deaths.
Hi, thank you for watching. If you want to see more of our videos, please subscribe. Hit the subscribe button below.